For the longest time, I denied myself the acceptance of having trauma. I was ashamed of it. And apparently, I'm not alone. Greetings all and welcome to The Pivot Point. I'm Tyron Harding. Last week, I was having a discussion with a friend of mine. For context, this friend is a successful professional in his late 50s, and last year he caught COVID. When I was asking him about his health and how he's doing health-wise, he said to me, I don't want to liken it to PTSD, but I kind of feel like I have PTSD from it. I immediately understood what he meant, because I've used the same rationale when describing my own situation. We tend to deal with two absolutes. Either we are okay, or we have PTSD. We often ignore that gray area in between. Now, that gray area in between happens to be trauma. You see, to be diagnosed with PTSD, you have to meet the requirements. These requirements are 6 separate symptoms in 4 separate categories. For myself, I meet 5 of those symptoms. Does that mean that because I don't have all 6 and I'm not diagnosable as PTSD, that those 5 symptoms disappear? Of course not. We need to allow ourselves to accept that trauma is real, trauma is common, and it is completely okay. Studies are showing an increase in anxiety, depression, and other trauma-related disorders, all due to the pandemic. This is for those that have contracted the virus as well as those that have not. We need to focus on mental health because that is going to be the next crisis that we face. Do yourself a favor. If you are not feeling okay, even if it's not full-blown PTSD, but if you're just not doing well, seek assistance. And remember, trauma shouldn't be a taboo. Thanks, and I'll see you in the next one.